Welcome back to the Morning Blend. We all know the importance of brushing and flossing our teeth, but a new survey shows some interesting facts connecting women, pregnancy, and oral health. OBGYN Dr. Brightman is here to discuss these new findings and help you stay healthy if you're expecting. Good morning to you, Doctor.
Good morning, Molly.
So tell us about the results of this survey. Anything in there that surprised you?
Actually, this was very interesting. This was a survey conducted by both Crest and Oral-B, and it shed some interesting light on women, pregnancy, and oral health. And what was interesting is that 23% of women who were pregnant or were recently pregnant actually noted a decline in their overall oral health. And 70% of women in this group also noticed some signs of gingivitis. And what's really amazing to me is that only 56% of women in this study actually saw help from a dental care professional during the course of their pregnancy, which really amazed me.
Yeah, I'll say so. And I think that's the thing is, I remember reading in a lot of books how important oral health was, and if you had any issues, you should visit your dentist. I thought, what does that have to do with pregnancy? But it does affect oral health. There is a direct correlation, isn't there?
There is a direct correlation, and I think women in general should have good oral health habits, which they should carry with them through pregnancy. But we know that when women don't brush properly and don't floss regularly, they increase their risk of developing gingivitis. And gingivitis, if left untreated, can progress into periodontitis. And periodontal disease in some studies has been associated with preterm birth, premature birth, and infants of low birth weight. So I think if women adopt, very healthy oral habits by brushing twice daily, using an alcohol-free mouthwash such as Crest Pro Health, they'll really maximize their ability to have a healthy pregnancy. And I think it's really important that women get that message.
And what do you suggest in terms of flossing? How often?
I recommend that women floss once a day. I think that's really important. In general, women are eating a little bit more often. Frequently, they have cravings or they're eating snacks, and so they should brush after their snacks and floss at least once a day.
Do you suggest either morning or night, or does it not matter?
I don't think it really matters. I think probably night more so than morning because you're getting a day's worth of plaque buildup. But brushing regularly, especially if women have particularly sensitive gums, they may not tolerate brushing. So that's when flossing becomes important, and also using a mouthwash that's alcohol-free, such as Crest Pro Health.
Are there other changes that can be made to help increase your oral health during pregnancy?
So that's a great question. Eating healthfully is really very, very important, and women should have plenty of calcium and vitamin D. They're very important for not only a mom's teeth, but also for the developing baby's teeth as well. And then having vitamins A and vitamin C and folic acid are also important. And then, again, trying to avoid sugary foods, and certainly brushing regularly, especially after snacks, and then flossing as well. These things will facilitate a healthier pregnancy, lessen one's risk of developing gingivitis, and lessening their chance of potentially having a small birth weight baby and they'll be able to avoid putting themselves at risk for an early delivery.
Well, and I see you have a power or electric toothbrush there next to you, and it took a long time for my dentist to convince me about the benefits of it, but my appointments are so much quicker and my reports are so much better now that I use it at least twice a day. It's made a difference.
Well, I think it can. I think the key thing is that women should brush twice a day for 2 minutes at a time, and they should remember, especially during pregnancy, they are brushing for 2. If they have access or they have an electric toothbrush, I think that they will have more plaque removal, and it's better for their gums. But I think the real message here is it's important for women to take care of their teeth, take care of their mouths, and brush twice daily.
It's great advice, Doctor. Thank you so much. And where can we go for more information?
So for more healthy information and more information about brushing for 2, women should go to crest.com and oralb.com.
Thanks again for your time. We appreciate it.
Thank you.